Доброго дня, шановні.
Good morning, dear ladies and gentlemen. We begin our traditional press conference organized together with the Center of Crimea and the Fund of National Strategies with the support of Ukrainian Crisis Media Center. Our press conference is dedicated to the state of medical healthcare in Crimea. We call it symbolically word number 6, and then the situation with healthcare in occupied Crimea. We invited to participate in our press conference the professionals who know well the topic of healthcare in Crimea. Participants, so we have Valentyna Ocheretenko, who is a representative of the Union for Patients Protection, and also Iryna Vlasenko, who is from Ukrainian Union of NGOs, Ukrainian Diabetic Federation. Later, Romana Stapchuk will join us from Press Center Free Crimea, and who will comment infographics our professionals prepared for this press conference. What is interesting for us in the part of healthcare in Crimea and medical services in Crimea is to which extent the system has changed in Crimea. It has changed substantially because since January 1st, 2015, in Crimea they introduced Russian legislation which introduced compulsory medical health insurance, and that brought to that all the Crimeans received policies of SNILs, as they call, without presence of which a person cannot get any assistance in state medical institutions, healthcare institutions. If you have extraordinary situation and you are not a citizen of Russia and suddenly came as a tourist, they will take you to the hospital, but all the rest of the people, for them, they can go through the paid health care, and which is quite expensive under Russian conditions. What our Crimeans are facing in occupied Crimea is that they introduce difficult obstacles, artificial obstacles for medical health care. If someone could come and get assistance from a doctor on the same day, independently how long they can wait, now they can artificial obstacle, and they have to sign to district doctors, and they limit the number of patients, and not more than 10 per day. And it happens very often that there are cases Crimeans write about someone has to come to have UZ of lungs, and they signed. They will have to wait for half a year to get to the doctor. If someone who doesn't like a district doctor or local doctor, pediatrician, or they can write a statement, and they can go to a different doctor, but not they can do it not more often than once per year. If the same with the doctor, they said they send a state letter to request to the main doctor of that hospital. It doesn't mean that they will satisfy it. If they do, they write a letter to the other principal doctor, and there is no guarantee that that request will be satisfied. Like in a Soviet comedy, there was a Italian professor whose passport he lost, and physically he was not able to go to Italy, could not leave the plane in Sheremetyevo. So this is about many Crimean patients who sign up somewhere and they cannot sign up for some hospitals. So the only alternative is public hospitals, and the issue of salaries. Right after annexation, they started to pay more to doctors, and now the payment for the doctor of the highest category is on the level of 37,000 Russian rubles. So that's junior medical staff. They received 12,000 Russian rubles, but because in Russia there is a policy of to reduce the personnel in medical institutions, and even in Moscow there were massive protests of teachers and doctors, because in Moscow they reduced the number of district hospitals, and people, for example, who Moscow is a megapolis, and to get to a the hospital, they had to drive for half an hour now, an hour and a half to get to. And the same is Crimea. We will see that on infographics, and Romana Stepchuk will present it and with concrete numbers. In addition to that, and to pay, they reduce hours on the job. So the numbers I gave you, that is on paper, but in reality, people get payment at least 2 times less from the number I gave to you. I would like to give the floor to Valentyna, who I think has the situation which we had before annexation, and for us to be able to compare healthcare. And as to our citizens, can our citizens in Crimea and 2,400,000, if they need, if they go to the mainland Ukraine, will they receive medical assistance? Do they need additional documents, or just on general basis for Ukrainian citizens? Good morning. First of all, I would like to quote one Russian expert, and who says the following. These are his words. Since Crimea is not said, then illnesses and healthcare in Crimea is like everywhere in Russian Federation. I wanted to start first of all with the statement that compulsory medical insurance in Russia showed that it doesn't work, it's not good. There are a lot of publications that is dying out. For us, it's very interesting because, in my opinion, it's better to learn from mistakes of others. How that affects residents of Crimea. Likewise, the rest of the Russian Policy covers only a small part of guaranteed part of healthcare services, and as Taras mentioned, that minimum, not always you can get that minimum, and it's very difficult as to swap in hospitals and doctors, and in Ukraine we have the same rules, as I call it, Yuri's Day, and with doctors, and it's very difficult with hospitals. It's very difficult to get to sign up. All of that costs big money, both in Ukraine and in Crimea. As to the second problem, I would speak about the problem medical personnel. In addition to what you told, there is a problem also with migrants. So someone who does not have Russian passport, they cannot work as doctors. Colleagues support each other. That's why in Sevastopol, very close, the doctors will leave from their service and promised golden mountains as to high salary and other benefits. That has not become true. The big threat for Russia and also for Crimea is limited import. It is prohibited to import many medical medicine, including bandages, and I was shocked. But we know about that in Ukraine even, because Russian bandages compared to Uzbeks are much worse, and not even edges are not processed, and not even so you can see that on the pictures of Russian production of bandages are very accurate according to German technology in Uzbekistan, which we considered the country lagging country. They are producing very good bandages. Continuing the support of patients, and Pharma announced that all medical preparations of Ukraine from Ukraine will be replaced by Russian products. Not always it's possible. There are some unique preparations and produced in Ukraine and that are used by patients in Crimea. I think that my colleague will speak about the issues of diabetes and insulin, but there are some other preparations that are unique production in Ukraine, and it will be not that easy to refuse them in Crimea. Other problems people have in Crimea. Not only doctors who don't have a Russian passport, but also patients if they don't have Russian passports, and that limits the access to medical services. And it seems to me that our task, or the mainland Ukraine, to show that those who take a risk to move and move out, it's a difficult process, but they are taken care of, and they have access, simple access, easy access to a healthcare institution. Then that will reach Crimea very quickly, and they will dream about the return of the status which officially they should have in Crimea, because it's our Crimea, not you Crimea. And what other issues? There will be questions. I wanted
to ask you a question about the qualifications, recognition of qualifications in Ukrainian diplomas. For example, I know that in Crimea the Russians do not recognize Ukrainian notaries and diploma of notaries. Whether they recognize Ukrainian medical diplomas, I will give the microphone to Iryna to answer. I want to say I've been working in the National Academy of Postgraduate Education, and the issues of qualification, confirmation of your professional status, accreditation of the documents is the responsibility of our institution, and between our countries there exists such a procedure as a confirmation of diploma. And it requires some 4 or 5 months of additional training in our institution. I am representing Ukrainian Association of Diabetics, and the situation in this area is very, very complex. I cannot imagine that this big territory with patients, diabetic patients, they remained without specific medicine, and insulin could be slightly different, and the absolute amount of patients, diabetic patients in Ukraine, they got accustomed to the insulin of Ukrainian production, which is slightly different from the insulins of other origin, and nobody knows how they will respond to insulin from other sources. And quite often we receive information that in Crimea they lack several types of insulin, and many times we tried to help via our connections with International Diabetics Federation, but the logistics is quite difficult, and some insulins could be imported to Crimea via humanitarian assistance, and nevertheless, those patients, they require not just adaptation to new types of insulins, and on the other hand, it requires consultations of medical specialists in different spheres, and I cannot say that in Ukraine you can get easy access to the specialists. In Ukraine this requires sometimes 2-3 months. And thus the quality of life depends on your access to such assistance, while there in Crimea it takes almost 6 months. In Russia, there is the registered growth of mortality rate, and this is due to the big program on closure of rural hospitals, and unfortunately, throughout Russia, this became massive trend, and now in Crimea they implement the same policy, and I believe that before cutting down the number of beds, hospital beds, the number of inpatient hospitals in Ukraine, we should study this negative Russian experience. And there are some international studies showing that decrease in inpatient hospitals results in the increase of mortality rate, and the studies were carried out for a 25-year period in the United States. I also wanted to ask a question. At one of our previous press conferences, representatives of the Social Policy Agency mentioned that in Russia there is a quite different policy in terms of support to the drug addicts, and there is unofficial statistics that in Crimea more than 60 people, Ukrainian citizens, died because they were deprived from the sources of the methadone program. I won't comment this position because I have rather negative attitude towards methadone therapy, but on the other hand, in Crimea, then they now open so-called drugs chambers in the pharmacies, where they will sell these drugs to the drug addict patients, and so they try to resolve this problem. I'm an employee in the pharmacy. The sale of drugs officially is allowed via special medical prescription, but unofficially it is possible to get them illegally, and you cannot predict you can easily predict how it will go in Crimea for the future. In Russia, there is some specific system and they spend a lot of money on it, while in Crimea, when there are many people who need this support and therapy, only some of them receive these services on provision of necessary drugs. Now I would like to invite Roman Ostapchuk to comment on the infographics which we have here. We have prepared this infographics for you to illustrate the major information which we heard today. Our infographics is called word number 6, the state of medicine in the occupied Crimea, and it shows that before annexation, Crimea was a resort, spa resort area of Ukraine and of the former Soviet Union, CIS countries, and many healthcare institutions there were subordinated to Ukrainian healthcare ministry. And before annexation, we had 29 in Crimea healthcare research institutions was one, and then hospitals, 3 hospitals, 3 children's houses and children's hospitals. 3. The Russian healthcare system, as Taras mentioned, the Crimean healthcare system has launched the Russian healthcare system from January 1st. And this is the OMS medical insurance, and you cannot change your family doctor unexpectedly. You can do this just during one day. You can also change your family health care institution just within one day a year, and that new healthcare institution which you choose has to provide you with a special consent letter in advance, and the budget of the Crimean healthcare system for the next year will be 28 billion rubles, and there will be 10 billions of deficit, which means that the funding of the Crimean healthcare system would be 30% less. Alexander Mogilevsky, the so-called Minister of Health in Crimea, mentioned that this year the responsibilities of the healthcare ministry in Crimea will grow up, and this will increase. This will give rise to the loan queues, and approximately 2 times a week we can read in social networks how people are unhappy with that long lines in the healthcare institutions. The salaries the average wages there will be between 18,000 rubles per month. The previous speakers mentioned that the vacancies in Crimean hospitals are not all filled. Like in Sevastopol, there is 20%, while in Yevpatoria, the deficit of general physicians is at the level of 75%, and administration in Crimea has been acting very unprofessionally. People say that they feel themselves in a position of slaves, and they are not willing to work in those healthcare institutions. The deficit of medicines is felt everywhere and by many people. Russia has filled Crimean pharmacies with expensive medicines and which are inefficient, and they implement in Putin's order that 95% of medicines in the pharmacies should be of Russian production, but they are not always efficient. Thank you, Romana. Thank you for this infographics. Would you like to comment something which Roman mentioned?
Only one more thing. I just remember one number in the first quarter of this year. Fund of compulsory medical insurance is 18%, though it should be 25% because the quarter is 1 quarter of the year, and the last deficit of the fund, insurance fund, and a deficit of which is growing. It puts a big question puts under the question medical insurance program in Russia. Thank you. Now we can switch to questions of journalists. If you have any question, please, and I will come to you and address your question to one of the guests, please. Okay, I wanted. Okay. Everybody says that the Crimea is not used but ours. From medical point of view, how do you help pro-Ukrainian citizens of Crimea? From medical point of view, by medicine, do you provide any support? Yes, how, and if not, why not? Very, very tough question. Because to risk and to cooperate with us, people who are in Crimea, they don't want to cooperate with us. We called our colleagues, and we don't feel the special enthusiasm, but we'll have to give contacts of our colleagues from Russian groups of patients and just patients, Russian Diabetes Association. So they will have to get their assistance, because as I am an oligarch, and I can help Crimeans. How can I do it when I cross the border? What do doctors say? How did they answer to you? The question was similar. It is a tough question because they can answer to us only by phone or by a letter. Nobody would like to take a risk. To risk their career, because employment is not very easy in Crimea. Likewise, here we have problems with unemployment. I don't believe that it's correct to ask such questions, but when they call us and we look at how to do it in the best way, not put an additional risk on them. In my opinion, the most important what we can do for them is we can create normal conditions for those who moved from Crimea, for them to spread the news to which extent how good it is within our healthcare system on the mainland. A question to Valentyna. Valentyna, you told that preparations, so Ukrainian preparations, they are going to replace them with Russian, but they cannot because they are unique. Could you, in addition to insulin, what else? Are there some very important for life? I'm not ready to answer to this question because it happened that I didn't have time to prepare details for this press conference. We found out that we would be key speakers here 15 minutes ago. In Ukraine, we have quite a big number of our Ukrainian preparations. I don't speak about insulin, but the situation is very similar. Yeah, we had a Gipertozine program, and quite that list can be really big. We have a lot of factories, pharmaceutical factories, and quite good. That's why penetration of Ukrainian producers on our market was quite serious. So all the niche now will be filled with Russian preparations, and that causes what I told you before. Thank you. There's one or two what Valentyna told. We always invite representatives of authorities, but the situation is very strange because I invited Mr. Kudashvili, Minister of Healthcare. I dropped the letter invitation, but the minister refused to come by himself. He refused to sound the head of the department because I'm not public servant. I'm a free person and I can comment why it happens because they have nothing to say. Because in Ukraine there is no state policy, there's no strategy as to Crimea, and they are banally afraid to say something which can be against public policy, but there is nothing to be afraid of because there is no state policy as to Crimea. That's why we have. It's one of the tasks of us that we raise this issue, and we are very thankful to Iryna and Valentyna that they found a chance as an opportunity to come and to give their comments because our executive branch is very is afraid of many things. So I invite all the people personally, directly or indirectly through letters, but not always there is a feedback. Roman had something to add to humanitarian cargoes. We touched the issue of healthcare in our previous press conference when I spoke about humanitarian assistance, and where we could clearly see the attitude of Russian occupation authorities to healthcare, because in 2013 it was Ukraine, Ministry of Social Policy, they recognized medical cargoes to Crimea for more than 300 tons. Medicine, bandages, syringes, but the occupation authority did not recognize that as humanitarian assistance and destroyed it as cheese. Now the cheese parmesan they destroy now. They destroyed medicine that could be help poor people and that could go to medical institutions of Crimea. Thank you, Roman. Maybe someone else has a question. If not, I would like to address a question to our participants. We spoke here about those mistakes. We analyzed them about health insurance, and smart people learn from mistakes of others. So you looking at occupied Crimea, we can look how through a microscope on what that system gives. What is a better variant for Ukrainian reality? If we see that experience, at least in Crimea, maybe it's a bad realization. Maybe it's not a problem of health insurance. Or no, as to compulsory medical insurance, that is the situation through Russia. It's not only in Crimea. Many experts, Russian experts, they state that it's difficult to call it compulsory, mandatory medical insurance. It's additional taxation. In the world, they're trying to convince us that insurance system is the broadest and it's the optimum. There are 1/3 of the countries that use health insurance, starting with Germany and up to the US. As economic analysis shows, this is a more expensive and less efficient system. Healthcare organization has a lot of indexes when they analyze, but they recognize Cuba as the best healthcare system. Insurance is absent completely. Experts advise to approach accurately and to use state insurance system. Something should be insured. There's no need to call it insurance. Maybe some kind of tax that will be fixed for healthcare, because the system of insurance brings to creation of additional personnel, additional expenditures. We should understand that insurance is business and meant to get in profit. The goal is not to get health of the nation, but also to get a profit for insurance system. This is the first point. And now, I like medical modeling in healthcare, and it seems to me that the methods that are broadly used in healthcare systems and also in farm business and also in medical. But doctors, when they model treatment process, it should be brought to Ukraine. We should step over a whole stage, and instead of expensive and not free of danger experiments in pilot regions, we can model process and we can choose the best, and only after that we can introduce some changes. At present, for me, the situation looks like this, that we are so poor that we don't count money. We should count money, and then we can build a system which will allow us to preserve people in Ukraine, because a demographic situation in Ukraine is very difficult. So maybe Iryna, maybe you have something to add. No? Okay. Then we'll finish. This is the end of our press conference. We would like to thank the participants, Valentyna and Iryna, for their participation in this press conference. It was quite an important issue, because healthcare services, as Valentyna told, it's about Ukraine also. And there is a big number of problems here. We will return over here in 2 weeks. See you in 2 weeks, and thank you very much for participation in this press conference. See you in the future. Thank you.
Мы думали, что мы придем, посидим, послушаем, зададим вопросы.